Okay, so we're just getting started here. We're just using that shaver just to irrigate a little bit. And loose body number 1 right there will turn off the flow. That might be small enough we can just grab it. Sometimes if they're really small we can even use suction. But here you can see our grasper come in. Back here is the meniscal tear we can see. So that loose body will come floating back in a minute. Let me orient things a little bit better for you. Okay. Yeah, I'm not happy with the white balance. Can you hit it one more time for me? The white balance on the... We're going to white balance one more time, get a little clearer picture. On the left side, third box down on the left. Or on the... Sorry, second box down in the middle. That's what I meant. Okay, there we go. So now we're going to put our shaver in. And there it is. There's one of them anyway. This is the meniscal tear. This is the medial meniscus. That's one of the loose bodies. And if it stays right there, we can grab it. Otherwise, we use our suction. So there we've got it, okay. So that's gone. We use a curved abiter. It can be, if you have a curved one, that'd be great. This is the cartilage on the femoral condyle up above, and you can see it's a little bit soft there. It's part of the reason we're doing that bone marrow concentrate injection. Here's the meniscal tear, all through here. So you can see some of it's been, looks like it's been torn or worked on before. But some of it probably still needs a little bit more trimming here. I'll be looking for one that either like a back cutter, if we have one. Hold the camera here, please. Sorry. Okay, so we're just going all the way around to the rim. That's what we're feeling there. And now with our shaver, we can evacuate all those loose pieces. Just like that. Okay. So that's looking better. There's still a little bit of a transition zone here I'm going to work on. We'll show you some more in a little bit. Okay, so we've got this transition zone smoothed out. So we've basically had to work on the body and then a bit more on the posterior horn here. And as we look at the femoral condyle up above, we can see this is an area where some of these loose pieces may be coming from. And we'll hopefully be able to firm that cartilage up with some of the orthobiologic injections that we're talking about doing. Still some small loose pieces floating around. That's why we keep the suction going pretty much all the time. But that's a pretty good shot of how your knee looks. So we'll go ahead and look in the middle here. This is your ACL. One second here. Okay, so there's your anterior cruciate ligament right there. Just behind the shaver. Your posterior cruciate ligament's back behind this fat pad over here. But this is your ACL coming off the tibia down below. That looks good. We'll go ahead and get rid of this lateral poster. We're going to look in the lateral compartment next. Pause. Okay, so now we're looking in the lateral compartment with your right hand. Push down on the knee. And as we look here, there's a little bit of thin kind of radial tearing in the lateral meniscus. You can see with a little bit of suction, it's not very stable yet. And the other thing is, as we look at the cartilage on the tibial plateau, see how that's kind of buckling. Now remember, things are magnified about 30 times on the screen, so the diameter of that shaver is only about 4 millimeters, 5 millimeters. So that just gives you an idea of the scale that we're dealing with. But you can see how that could potentially create loose pieces. I don't want to dig into it, but if there's anything that comes to the suction, then we'll remove it easily. Okay. Okay, so we're pretty much done making sure this lateral meniscus is stable. I don't see any other loose bodies. You spent a fair amount of time looking all the way in the back here. And fortunately, we don't see anything else to worry about. That meniscal tear was leading to the cyst. Let me see that real quick. And so I think we got that under control. We're going to look now in the patellofemoral area, which is right here. Sometimes there'll be some loose bodies that get trapped down the medial gutter here. Although, hold the knee just like that. I don't see any in your knee right now. That's good. We'll come back up. This is the suprapatellar pouch. Nothing there. This is the lateral gutter that we're going down here. And as you look back here, yeah, there's a little something. See that? So we'll free that up. Usually that's small enough that that'll just be sucked out with our shaver. There it is there. So we'll just back up here. There's our shaver. Is the suction on the shaver? Is the suction on the machine turned up all the way? Yeah, put on like 6 or 7 or 8. Yeah. It's on 0. All right, so we'll keep working our show for a little bit. Okay, so now we're going to get a look up at the patella. This is it at the top of the screen, and this is another area where loose pieces can often come from. You can see a little bit of softness over here on the medial facet. As we look over here at the lateral facet, looks okay. All the way over there. So we're just going to irrigate a bunch of water through the knee and make sure there's nothing else to worry about. The cartilage and the trochlea here looks pretty good. We can follow this all the way down to the front of the knee, all the way down here. What's going to be down there will be the ACL, and ultimately we'll see the tibia if we keep going down into the notch region. It's a little bit of the fat pad blocking our view, which is fine. So we're going to keep going here. We'll show you some more if there's anything else, but otherwise I think this will be the end of the video. Good luck to you now. Bye-bye.